Hello, I hope you're all okay. My name is Anicton Buto, a tutor in the Department of Clinical Medicine and Surgery. And today I want to take us through the management of different traumatic wounds. And of course, this is an interesting topic. We've got different wounds, and in trauma, of course, wounds are one of the most common issues that trauma patients present with. And therefore we need to be able to understand this so that we can be able to properly manage them. Come to this video, I'm only going to talk about mechanical trauma wounds. Of course, we've got other kinds of wounds that are like burns and chemical wounds. Of course, they are talked about in another session, but in this particular session, we are only going to focus on trauma, mechanical trauma wounds. And put this. Okay, so what is a wound? A wound is an injury that disrupts the physical architecture of body's tissues. Anything that disrupts how tissues are organized, then that's what a wound is. And wounds may be open or closed, because depending on the integrity of skin overlying the wound. And the wounds can range from very small and simple that they do not even require any medical attention, but to some extent they can also be life-threatening. So everyone gets a wound at least once in their lifetime, and possibly you have also had a wound at one point or another in your life. So wounds are that common. And therefore, it's apparently important that we understand the mechanism of injury of wounds, and therefore how do we manage wounds. Okay, so we are going to talk about types of wounds, and when we talk about types of wounds, basically here we are doing a classification, and whenever we do a classification, we look at a criteria of classification and use that criteria to group wounds. And we can have, I picked 3 criteria here, and one of them is duration, the object causing the wound, and penetration. So when we talk about duration, we talk about the age of the wound, and acute wound or chronic wound. An acute wound is one that has got a sudden development rather than a development over time. So acute wounds, generally this is a wound that like you've gotten today, that's an acute wound, less than 2 weeks. So these wounds usually heal at a predictable and expected rate according to the normal wound healing process. And the other ones are chronic wounds, and a chronic wound is one that has failed to heal in the expected time for that particular type of a wound. So then it becomes a chronic wound. So then when we talk about open wounds or to have another criteria, either open or closed wounds. So when you talk of open wounds, you can have now, depending on the cause, what causes that wound, you can have an incisional wound, and this is usually a clean, sharp-edged wound, and the cause here is usually a very sharp object, such as a knife, a razor, or a glass splinter. So you find a sharp or a very clean cut. That's an incisional wound. Then you can also get a laceration. Laceration is a tear. It's an irregular tear in the skin, a wound that is caused by blunt. So when you have a blunt object that is moved across a tissue at a high energy, then you end up with a laceration. The other one that you can get is an abrasion, and abrasion is a scraping of the skin. So the topmost layer of the skin, you find it's scraped off. That's a laceration. And then you've got avulsion. This is when a body structure is forcibly pulled off its attachment area. So we also sometimes call them degloving injuries. So you find, for example, the skin is pulled off a finger, that's an avulsion. Then you've got a puncture. A puncture is like when you have a needle going into your tissue or a thorn going into your skin. It's a puncture. It causes a puncture on the skin. Then you've got penetrating wounds, and penetrating wounds are caused by objects like knife, which enter into the skin and come out. And gunshot wounds, of course, these are caused by bullets. Maybe here we have we have 4 wounds, and you can help us be able to uh, name these wounds. We've got, this is number 1. So what could number 1 be? We look at this is wound number 2. What could this be? And number 3, number 4. So looking at maybe we start with number 4, and you can see already the doctor's hand is here, and we have a scalpel here. So this is an incision wound, and if you look at it, the edges are very smooth, the clean cut wound. So this is an incisional wound. And when you look at number 1 here, you can see this is a cut, yes, but look at the margins or the edges. They are rugged. So, and you can see even the ecchymosis around. So this is a laceration. We had a blunt force here that causes a tear in the skin, and that is how you end. It's a laceration. Wound number 3 here, you can see this is the skin. Maybe this could be the abdomen or another part of the body, but you can see the superficial, the topmost layer of skin has been kind of scrapped off, and this is an abrasion. And then here you can see a flap of the skin. So this was forcibly removed from its attachment area. So this is an avulsion. Okay, if you got them right, all of them 4, thumbs up. Now, when you talk of closed wounds, this is where the skin is intact, but now the architecture of tissues underneath has been disrupted, and you can get mainly hematomas here. And hematomas, this is generally a blood clot under the skin. Caused when blood vessels are ruptured under the skin, causes bleeding, and the blood generally will clot under the skin. So hematomas can originate from inside or can originate from outside. When you have hematomas originating from inside the body, then you talk of petechiae, purra, and ecchymosis. So, for example, you have blood vessel anomalies that now causes bleeding under the skin, then you can have these things. Now, when hematomas originate from an external source, for example, you are hit with a rungu, or large forces applied, blunt force, then you can get contusions, you can get bruises. Of course, all these are kinds of hematomas. Then you can also get crush injuries and closed injuries. And crush injuries is where you have the skin is intact, yes, but the underlying tissues have been crushed. Okay, sorry for that. So you get the skin is intact, but the underlying tissues have been crushed. So this is usually caused by an extremely large amount of force applied over an area for a long period of time. So for us to understand the management of wounds, we need to understand the natural process of wound healing, first of all. Now, this is something that you tackled already. Um, Once you have a wound, generally it is going to heal through these 4 processes, or the 4 stages. And the first stage is hemostasis, or clot formation. So there's going to be bleeding, of course, and this blood will clot, and that clot stops bleeding. Then this one can last up to 12 to 24 hours, and then inflammatory phase sets in, and in inflammation, you've got all the immune cells now coming in, trying to remove the debris, and you've got that is vasculature increasing, that is vasopermeability, and this blood supply to that particular area is increasing. Fibroblasts coming into place and trying to knit the tissues together. So that is inflammatory phase. And then after that, you're going to have the proliferative phase, and this is a regeneration phase where the worn out tissue or the destroyed tissue is getting replaced. Now you'll have the granulation tissue now growing. And then finally, you're going to have the remodeling phase, where you are going to have reepithelialization and maturation of the scar. So that is the normal way wound is supposed to heal. Of course, wound healing is also a natural process. And wound healing can take two different approaches, and that is what we see here. A wound can heal by primary intention or can also heal by a secondary intention. Now, where the difference comes in is simply how, how far apart are the edges? Can they be drawn closer and therefore healing becomes side to side? Or the edges are far much apart, and as such, then healing has to start from bottom and grow to cover the space that was destroyed. That is where the difference is. So in primary wound healing, you find healing side to side, and tissues are well opposed, and they just heal from side to side. But in secondary healing, you find they are far much apart, and the growth has to start from the base, and the granulation tissue has to grow from the floor and fill the. So if we compare the two, you will find in primary wound healing, uh, mainly we talk about surgical wounds, but here we talk of traumatic wounds. Of course, not all traumatic wounds, but we generally will talk about the gap between the wound, between the edges. Now, we've got a narrow incisional space resulting in limited inflammatory reaction in primary union, while in secondary healing, the gap between the edges is quite large. There's a huge amount of inflammation because of course, the amount of destroyed tissue that comes with that. Then granulation tissue invades the incision space in primary wound healing, while on the other side, you've got a granulation tissue has to grow from the floor and come upward. Then we've got a limited amount of wound contraction in primary wound healing, while it's opposite in the secondary healing. And primary healing generally takes shorter, and compared to secondary wound healing, of course, because of the amount of granulation tissue that you have to build, the amount of remodeling you have to do. Also, primary wound healing, you'll find, apart from it taking shorter to heal, the cosmetic outcome is better in primary wound healing than in secondary wound healing because of the amount of scar tissue that is formed in the two different approaches of wound healing. So when you talk of wound management, now we've said wound healing is a natural process. Now, when we're managing wounds, what do we want to achieve? Number one, we want to control bleeding. Wounds, like we said, can be life-threatening, and if a wound is large, it can really bleed, and this can cause us trouble of hypovolemia and shock, things like that. So we really need to manage bleeding. We need to prevent infections or manage them if they have already set in. We need to shorten we manage wounds to be able to shorten the duration of healing and also to improve the healing outcome. Things like the amount of scar tissue formed, healing with deformity. We manage wounds to be able to improve such outcomes. So in management of wound, these things are going to really influence our management, and that is the type and size of the wound, the location of the wound, and the edge of the wound. Of course, for example, the way you manage a laceration is not going to be the way you are going to manage an avulsion. These wounds are different, and Of course, the size also plays a role. Then a wound on the face, for example, you're not going to manage it the same way like a wound that is on the foot. These two things are different, and they are going to tell us how then do we adjust in these two different circumstances. And the age of the wound, a wound that occurred today is not the same as a wound that has taken 2 weeks. So these two, again, we are going to approach them differently. Now, in control of bleeding as one of the objectives, this one comes as a first aid management, and it can be achieved by positioning the wound site should be higher than the level of the heart so that you limit the amount of blood that is going to that area. You can also apply pressure proximal to the wound to limit the arterial supply to the ruptured vessels. And also you can do dressing. You can dress that particular part to arrest bleeding. Or if, for example, this was an incisional wound and you accidentally cut a blood vessel, a large vessel, then you can cauterize, and this is use of electricity to burn blood vessel and stop them from bleeding. When you talk of prevention or management of infections, cleaning and dressing is of key here. And of course, there are different antiseptic solutions that are used, as well as mulch. And it's good that you are aware of this and when to use them. Things like povidone iodine, when do you use it, when do you use another one? And there are really many of them, like even honey, quiron, and Savlon. All these things are antiseptic solutions, but you need to understand now when do you use which one. So of course you can take up that one as an assignment. And the mulch here, you've got you can use mulch is what you pack the wound with, and you can have things like gauzes. You can have things like um, paraffin gauze, the cotton gauze, paraffin gauze. There are so many of them, and you need to decide which one are you going to use for which particular type of wound. Of course, others are quite expensive, so cost implication has also to be considered here. And then that is antibiotic therapy also plays a central role here in wound management. So the antibiotics can be topical or systemic depending on the kind of wound that you're treating. But all in all, the choice of antibiotics should target the organisms that are suspected to have gained access or that will gain access to that particular wound. And wound toileting must be done to remove debris because debris welcomes microorganisms to come and feast on the wound and therefore cause an infection. And also, you need to give tetanus toxoid as a as a vaccine to prevent tetanus. Of course, this is the way that the organism gains access to our body and causes havoc. And then, of course, there's wound closure, which is a surgical procedure that closes now the wound. Instead of just leaving it, you can decide to suture the wound, tie the edges together, and therefore influence it to heal by primary intention. So we'll go a bit into detail in wound closure, and this is a surgical procedure, like I stated, to oppose, bring tissues together and hold them together using sutures or staples. It helps us to achieve, we can control bleeding with wound closure, we can prevent infections with wound closure, and influence this wound to heal by first intention. Remember, we said wounds that heal by first intentions are those whose edges are close by, and therefore healing is side to side, not when the edges are far apart. So by closing this wound surgically, we are bringing the edges together and therefore influencing it to heal by first intention, which again is going to take a shorter time. So which wounds can be sutured? Of course, incisional wounds and fresh wounds whose tissues can be apposed. Of course, you do not struggle to pull tissues that are far much apart and you cannot achieve good tissue apposition. No. Whatever you can oppose, then that is what you suture. Of course, there are contraindications. And all wounds that are infected, you cannot suture these wounds because the sutures themselves are non-living materials, no antibiotics there, and the microorganisms can cling to them and cause havoc in the body. And also, all wounds are not sutured unless you decide to refresh the wound margins. And there are edges that cannot be opposed. Of course, you do not suture this. For example, there's a large chunk of tissue that was removed, and you're trying now to bring the edges together. It will not, and you just end up into other trouble. For example, you can bring in compartment syndrome. Crash wounds are not also sutures because the degree of damage to these tissues is actually bigger than we can imagine. And then penetrating wounds, you also do not suture these because depth of the wound ideally is larger than the width of the wound, and you cannot really reach the depth of that wound. So you'll suture the top, but in there you've left a pocket, and tissue fluid is going to collect in there, attract infections, and you end up with an abscess. Same with gunshot wounds, you cannot suture them. Also, bites, you do not suture. So in suturing, you've got different types of sutures that you can be able to use. Of course, you're going to learn this when you do the skill of surgical wound closure, but just to give you a gist, we've got what we call absorbable sutures, and these are sutures that, when used, they are absorbed by the body, and therefore you do not need to come back and remove them. Okay, I think let me try to end the presentation here. Now, the other ones, that is, they are very useful, especially when closing deeper tissues. Their tensile strength, though, reduces with time, and therefore, as they get absorbed, and therefore, they are not very good when you are dealing with the places where tension is great because they are going to gap anyway. And then the examples of these are things like Vicryl and chromic catgut. I'm not sure what happened here. Maybe this slide wasn't really well captured. So I was talking of absorbable sutures, and I was saying these are sutures that once you use them, the body just resorbs them, and you do not have to come back and remove them. So they are very useful when you are suturing deeper tissues because again, you do not need to open the person again, go deep there, remove them. So, but the issue is that their tensile strength usually reduces with time as they get resolved, and this makes them not very useful in high tension tissues. For example, you are suturing a joint, then there's going to be movement there, and as time goes, they get resolved. So once you move, then the wound gaps again. Examples of these are Vicryl and chromic catgut. The other type is non-absorbable, and these sutures cannot be absorbed by the body. So when you use them, you've got to come back and remove them. They have a strong and standard tensile strength, thus they are excellent for use in areas of tension. So their tensile strength doesn't change with time. As in, when you put them there, the tensile strength is the same today, it's the same tomorrow, the day after, until you remove them. Examples are silk and nylon. So, in conclusion, wound management is part of our day-to-day work as traumatologists and orthopedicians, and understanding the mechanism of injury of a wound is essential for the wound for the wound management. Of course, we've got to understand the mechanism of injury. We've got to understand how a wound is assessed, so that these now can help you to arrive at a decision as to how now am I managing this wound. And the knowledge about the different options available for the management of wounds is of equal importance. You need to know what are the options I have. Otherwise, there is no need to understand all these if you are going to manage every wound the same way. And of course, as you focus on how to help that wound to heal, remember that cosmesis as an end product is also of great importance to our clients, especially when you're dealing with ladies. Then you really need to pay attention and have it in mind that after this wound heals, how will this lady look like, or how will this client look like? Because many people do not want to be left with scars. So we can influence this process, and we should be able to influence it so that the cosmetic outcome is also great, and this is what will make customers coming back to us every now and then. And that's it. Thank you for watching, and I hope you have questions on my timeline, and I'll be able to get back to you.